Informative speech on childhood obesity. Many doctors have called obesity the new American epidemic. Childhood obesity has more than tripled in the past 30 years. Children between the ages of 6 to 11 have increased from 6.5% in 1980 to 19.6% in 2008. Children between the ages of 12 to 19 increased from 5.0% to 18.1%. It is estimated that 58 million Americans living in the United States are obese, and 8 out of the 10 people who are overweight are around the age of 25. There are major health risks for our children who has childhood obesity. Childhood obesity increases the risk of orthopedic problems. Kids are forced to carry extra weight that their bones cannot handle. Childhood and adolescence increases the risk of developing high cholesterol, hypertension, respiratory ailments, depression, and even type 2 diabetes in youth. Obese youth are more likely to have risk factors for cardiovascular disease. In a population-based sample of 5 to 17-year-olds, 70% of obese youth has at least one risk factor for cardiovascular disease. There are numerous parental influences that shape the eating habits of our youth, including choice of an infant feeding method, foods that we make available, time our children are left unsupervised, and eating interactions with others. Studies suggest that parental food preferences directly influence and shape those of their children. Genetics is an abundance that supports genetic susceptibility as an important risk factor for obesity. Weight loss is not a good approach for most young children since their bodies are growing and developing. Overweight children should not be put on a diet unless a physician supervises one for medical reasons. For most very young children, the focus should be to maintain the current weight while the child grows normally in height. We as parents and caregivers can help prevent childhood obesity by providing healthy choices, daily physical activities, and nutritional education. We should also discourage eating meals while watching TV, buying fewer high-calorie, low-nutrition snacks and foods, involve the children in planning and shopping and preparing the meals. We should also encourage physical activity. We should limit the amount of time children watch videos, play video games, and get on the computer. As a mother, I have 2 children that battle with childhood obesity. And also, my husband and I battled childhood obesity and even battled obesity even as an adult. My children are very fortunate to be able to meet with a nutritionist once a month. When the nutritionist comes out, they talk about making healthy choices, what they are going to do to increase their physical activities. This has helped my children out a lot by helping them make the right choices and also able to know how much is in a portion size and how much calories and sugar is in each serving. One thing that the nutrition expresses a lot with my children is that yet again they are not on a diet, they are just making healthy choices to maintain their weight. We as parents must focus on good health and not a certain weight goal. Focus on the family and don't separate the overweight children from the others. We should involve the whole family and work gradually to change the family's physical activity and eating habits. We should also establish daily meals and snack times and also try to eat together as a family. Also, we as parents or caregivers can make sure that we give them sensible portions and use the food guide pyramid to help with the nutrition that our children need. The excess intake of calories above daily expenditure of energy leads to weight gain and eventually leads to obesity. Available research shows that there are a number of root causes of obesity in children. When thinking about early prevention of obesity, it is essential that more is understood about how genetics is involved and how genetics are triggered or react to environmental changes and stimuli. Even though prevention is not an option for many children who are already overweight. However, the fundamentals are clear: to stay healthy, eat a balanced diet, and devote adequate time to physical activity. These are just some ways that we can help prevent childhood obesity in the world today.